Hi, I'm Dr. Hayley Nelson, neuroscientist, psychology professor, and founder of the Academy of Cognitive and Behavioral Neuroscience. I get asked a lot by life coaches who come to me and ask me for advice because I know so much about the brain. And they are working with clients who tend to sometimes be hesitant to actually do some of the wonderful tricks and tips and suggestions and techniques that they are providing to their clients. And they want to know why. How can they use and harness the power of the brain to be able to help their clients better? I'd like to bring up a graphic here to help illustrate a point for a before and after, what a brain looks like now, and what we hope that through working with you, through your techniques to help somebody overcome some of those boundaries and hesitations that they might be having for using some of your techniques. So here we have an example brain. This would be a brain that might not be functioning optimally because what we can see here, this area highlighted in red, is known as our amygdala. And many people call this the emotion center of the brain. It's really involved with fear learning and conditioning, among many other things. But in this particular case, what it's doing is it's overactive, right? You can see that it's red. And because it's overactive, this hyperactivity is actually lessening the function of this blue area that's highlighted on the brain, known as our prefrontal cortex, which is really important for executive functioning, decision making, among many other things. And this is not ideal. We don't want our amygdala, our emotional center of our brain, to run the show. We want our prefrontal cortex to be making decisions about what we want to do and how we want to behave and how we can properly think about situations that arise in our day-to-day life. So how can we go from this to a brain like this, right? This would be our after picture. This would be what the brains of your clients would look like after working with you through a variety of different techniques that you utilize, right? What we want is a fully functioning prefrontal cortex, as you can see up here. And by this prefrontal cortex working so well, notice it's actually lessening the impact of the amygdala, and vice versa. The amygdala is no longer hindering the function of the prefrontal cortex. Now the prefrontal cortex is running the show and helping guide our decisions and our thoughts. So how can we get from point A to point B? And there's a variety of different techniques that people can utilize. And really the end result is there's two things that we want to eventually have happen. We want the amygdala to stop running the show. So if we can selectively target the amygdala to stop being hyperactive, then we can get to this brain eventually. Or alternatively, if we can strengthen our prefrontal cortex, now the prefrontal cortex is running the show and hindering this overactivity of the amygdala. So, or you can do both of them at the same time, which is an ideal situation. So one way, for example, that you can directly target the amygdala to have it stop running the show is you can, for example, use prescription medications or even some homeopathic medications to selectively target this hyperactivity of the amygdala. Aerobic exercise is another great way that you can actually lessen this hyperactivity of the amygdala. Alternatively, if we want to focus on strengthening our prefrontal cortex and have that run the show directly, then activities and techniques that really focus on cognitive therapy, cognitive behavioral therapy would just be some great examples of how you can focus on strengthening the prefrontal cortex to in turn inhibit that hyperactivity of the amygdala. Now, these are just two very brief examples of how we can utilize the power of neuroplasticity to help mold and shape and rewire the brain to a more effectively functioning brain through this process of neuroplasticity to allow your clients to get the results that they want, which is why they hired you in the first place. So I hope this little graphic and this brief demonstration helped explain a little bit more about the power of neuroplasticity and how we can understand more about the brain that you can then in turn use this knowledge to help your clients better. Thank you so much.